My name's Dr. Paul Hodgson and I'm a chiropractor, and we get miraculous results with blood pressure. We've been able to get so many people off of their blood pressure medications. It's amazing. We need to look at blood pressure a little bit differently than typically happens in a Western medical office. So the idea of 120/80 as the perfect blood pressure, believe it or not, it's actually sort of flawed. And so 120/80 is the average blood pressure. But I want to talk to you just a little bit about, what if you're walking upstairs? Do you think that you should probably have a little bit higher blood pressure? And the answer is yes, because your body needs increased blood pressure to send more blood to the muscles so that you can actually make it up those stairs. So 120/80 is actually the resting blood pressure. Let's say if you have a very stressful situation and you need to get things done and you need your brain to work really rapidly, do you think that your blood pressure would be elevated? And the answer is yes, and that's an appropriate human response. So if we're considering somebody who has an increased demand for blood pressure, and then we're giving them, maybe we're saying you're higher than the average, and maybe we give you a medication to lower your blood pressure, now when you need that burst of energy and you need that increased function, we're actually medicating against that. So we're decreasing your performance overall. Now we know that high blood pressure chronically over time is going to be an issue. It's going to wear the artery out faster and it's going to create health issues. So I'm not advocating that everyone run at a higher blood pressure than what's recommended. But I am recommending that there's times and there's places for high blood pressure, and they're sometimes appropriate. What typically happens is, if somebody's having a stressful day or if they have a stressful lifestyle, we'll start to medicate against that. But really what we need to do is evaluate what in your lifestyle is causing this high blood pressure. The chiropractic approach to this works at it from a lifestyle aspect, but there's also an interesting discovery that's been made recently. Chiropractors have been for years understanding and knowing that a chiropractic adjustment to the upper neck, the bones of the upper neck, actually lowers blood pressure really, really well. I've personally had many cases of people over 200 blood pressure, and we've been able to lower their blood pressure within minutes of a chiropractic adjustment by 50, 60, 70 points. It's almost miraculous. The reason for this is because that the bones of the upper neck actually surround the blood pressure regulation centers of the body. So when we have a misalignment with the bones of the upper neck and the skull, it can create major problems with blood pressure. In a recent article in the Journal of Human Hypertension, it was found that chiropractic adjustments to the top bones in the neck worked better than the leading two blood pressure medications combined at lowering blood pressure. This is a landmark study, and this was not done in a chiropractic journal. This was done in a journal for blood pressure, the Journal of Human Hypertension. I think there'll be more studies like this to follow, and very soon you'll see chiropractic as the main way that we deal with, or the primary way that we would deal with blood pressure before drugs and before other interventions.